Governor, the CDC is saying that in-person learning, regardless of age, is an extremely dangerous situation. Why are you keeping elementary schools open? And broadly speaking, why not begin elements of the pause right now? Why is Twin River open this evening, for instance?
Yeah. So I believe that what you said is a mischaracterization of the data. Dr. Ashish Jha, who is an expert, put out a fantastic paper just a day ago, making it crystal clear after a survey of all the data that there is no evidence that in-school learning is a spread. I have talked to Dr. Fauci, Dr. Birx, the CDC, our own experts, Dr. Jha, people at Johns Hopkins. Look all over the world, all over America, and all over Rhode Island. There's no evidence to suggest they are vectors of spread. In Rhode Island, where, to the extent we've had any issues, it's in high schools. Like I said, the only places we've had like 10 or more cases is in a high school, for all the reasons that I said. You know, kids are mobile, they're not in pods, etc. So anyway, we could argue about what is the risk, but about this we cannot argue. There is a 100% certainty that children will be sicker mentally, physically, emotionally, if they are out of school. And they will suffer, in many cases, irreparable lifelong harm for being out of school for more than a year. That I know for sure. So if more data comes out in a week or a month that says I'm wrong, then we'll make a change. But you got to look at everything you have now.
Governor, doesn't sending high school kids home kind of contradict what you've said, that they're just as likely to get the virus if they're not in school, and that they're still doing all these other things? How are you going to keep the high school kids from not going and doing all these other things if they're home for 3 to 4 weeks?
Yeah, so because I'm trusting them to follow the rules of the pause. So a couple things. One, if the district thinks that they have a plan to keep the kids in high school in their hybrid model, then they should do that. You know, like I think we've already heard from Charahoe and SK, that's what they're planning to do. But we've also heard from a lot of superintendents that they're struggling with density in high schools, and some of them actually say they can do a better job keeping the attention of these kids, because if they're virtual, they're synchronous virtual like every single day. So the same, you're right, like this is hardly perfect, but a lot of these kids in the high schools, they need to follow the pause too. They should just stay at home and do their studies.
Just overall, wasn't the idea back in the spring that if you get all the PPE, if you have the field hospitals, if you have the testing, the contact tracing, you're able to single out who's sick, who to quarantine, that you wouldn't have to go back to these measures? That was the idea back in the spring. What happened?
Well, that was the idea, and that's where we've been going. What happened is, it turns out people don't follow rules very well when they're in, when we have to do this for 8 months at a time. I don't think any of us, including me, accounted for the real fatigue that sets in. It's hard to follow these rules this long. And especially, you know, like when you're in these social gatherings. I've been surprised. I'll be honest with you. I have been surprised. You ask people not to have Halloween parties, and there are tons of Halloween parties. And people say, sorry, I'm just going to break the rules. So I don't know what happened. I don't know why that happens, but it does, and it causes problems.
The system was supposed to be in place to kind of support all this.
That was why I made the joke about the memes, me being living rooms. Like, I don't know, Brian. Human behavior is such that people decided not to follow the rules, and now we're in the soup.
Governor, as to the testing, I just talked to a restaurant owner on the way in, literally, because I was driving in. 138 people, somebody tests positive, she has to shut the whole place down. Nobody can get a test. They call, they do everything. She calls Dominion and hires them herself because he got a lot on the line. She pays $15,000. So we've asked you every week about testing. Well, no, the portal's fine and you can get in. You're hearing otherwise, and we're hearing otherwise from a lot of people. So I appreciate the fact that you're bringing on more testing. What is your goal in terms of ease with getting on getting a test and getting a result? Because I'm hearing 3, 4, 5 days, I gave up, I don't know. And at this point, do you think you need to scale back a little bit on the asymptomatic testing? Because what I hear is people call and they say, I don't have any symptoms, sorry, you're at the back of the line. So I understand from a philosophical point of view or theoretical why that's important, but it's shoving other people who have a cough, a temperature, and whatever to the back of the line because there's no slots.
Yeah. Okay, so a few things. Listen, it ain't perfect, but it isn't true to say people aren't getting tested. We tested 100,000 people in the past week. We're testing more than any state in America.
I didn't say people aren't getting tested. I'm saying there are a lot of people who are calling who cannot get in.
Well, you can get in, but it might take a few days. And so that's why we need to fix it. So, I mean, it's true. It's a pain to wait 5 days. And that's why I'd like to have it be a day, like in K through 12. You know, K through 12, that's, you can get your tests within a day, you get your results within a day or two. We need more of both. The honest answer is we need more of both. So starting next week, we are getting 100,000 more Binax kits a week. We are ramping up as fast as we can go. We're behind. I don't know what to say. We have to do more.
Just one more follow-up. So, you know, as the rest of the country, we were doing great, and the rest of the country had started to spike. So you were hostage to out-of-state labs and turning things around.
Yeah.
Is it all being done in-house now, or is it going to other places that other states are putting pressure on to get their testing done?
So we learned a lesson from that, and now we have like a menu of labs. So we're no longer as reliant on anyone. So we're pretty reliant on Dominion, which is local in Rhode Island. We have a special relationship with them, and Thermo Fisher. That's a great thing we did. Binax is in our control. You know, they're kits that we have. Some of it we do still send out, and yeah, we do compete. That is like still an issue. I would say it's frustrating. We're going to double capacity in the next 3 weeks, so I know it's going to get a lot better. And if you like that, it's hard for me to believe you can't get a test at all. If that's a problem, then I'm sorry, you got to call us. If you're waiting 3, 4, 5, 6 days, that stinks. In a week, it's going to be a lot better.
Governor, there's compelling evidence to show that. Governor, there's compelling evidence also to show, anecdotally, of course, that distance learning, when actually accompanied by a certified teacher, is going to have exponentially better results than in-person learning if, in fact, that is being maintained by a substitute who may not even be certified, given the shortage in substitutes. So, under the category of trust but verify, when will we start to see and understand the real-time statistics of what teacher shortages are occurring, where they're occurring, how much time is being spent in the care of a substitute, the standards of that substitute, and then so that we can really understand the difference, because it's not a level playing field. And finally, is there in fact a percentage, say much like New York, where once met will result in full distance learning?
Okay, I didn't follow the last thing, but I'll address the first thing. And it also relates to Brian's question. We think, by and large, the high schoolers do better with distance learning. They just, you know, think about high school. They're just more independent, able to independently engage online themselves. And we are tracking the results. The younger kids struggle more. The thing that you're saying is it could be the case that in an ideal world where everything works, child has perfect internet, child's fed in the morning, you know, child has a fantastic teacher who's teaching them synchronously and engaging them, checking in on them, that maybe would be better than being in person. Although you know, it's more than just that learning. We know abuse and neglect is going undetected because teachers don't have an eye on a student. We know depression, anxiety is up. We know sorry, I lost my train of thought. We know the children, food insecurity. You know, they're not getting fed. So I think it's safe to say that when you look at the totality of what a child gets out of school, there are benefits to being in school.
But in the Commissioner Bride, in her Zoom meeting, alluded to the fact that they have comprehensive statistics, as I'm sure they do, with regard to just what the crisis, if you will, in substitute teaching versus qualified teaching represents. When will we start to see those numbers so that we as the citizens of Rhode Island can actually understand and make our own judgment call? And then to clarify my final question, in New York City schools went to distance learning because they had met, as we would say in industry, a bogey. They had met a percentage where they in fact had to turn off the lights.
Gotcha.
Does that exist in Rhode Island?
Sorry. Okay, so on the first one, I need to get back to you. I misunderstood you, and I have to talk to the commissioner and find out what her plan is for putting some data out, and I will get back to you. On the second one, our bogey, to use your word, is not one metric. We have like 5 metrics. It's a combination of prevalence of the disease, and we've passed that bogey. But it's the school's ability, their operational ability to do it safely. So, unlike New York City, we have a separate K through 12 testing system. So we have good testing. We have separate, like in City of Providence, there's a custodian on every floor of elementary school. So as long as the schools are able to keep it safe, the kids are required to wear masks, the windows are open. We're getting a huge installation of HEPA filters and ventilators, which we're going to start to install. As long as they can keep the environment safe, then we're going to keep them open.
Governor, President-elect Biden might advise or might give out a 4 to 6 week lockdown, but he's set to be meeting with the nation's governors. Would you advise him to take your path of a pause over a lockdown? And then secondly, is your order to get tested first before you travel a way to deter people from traveling because of the amount of days that it would take to get a test result?
No, but that was a good one. A lockdown. Okay, if Congress would do their job and send an appropriate stimulus, then you could think about a lockdown. But in the absence of that, I don't know how you do a lockdown. I mean, I'm doing a 2-week pause and hoping people take it seriously, and I'm going to put a lot of money out the door of our own stimulus to help gyms and such who are going to be struggling. If you're going to do that and that's for 2 weeks, if you're going to do that for 6 weeks, these businesses may go permanently out of business. So, if you could do a 6-week lockdown with the appropriate stimulus, I could get around to supporting that.
But without that stimulus, would you advise him to go with more of a pause, which you're suggesting or putting forth today?
Yeah, that's the path that I'm taking. It's different in every state. I mean, look, Michigan, Wisconsin, these places are truly on fire, so I don't want to tell them what to do. But that's the path I'm taking, and I think that that can work. Also, testing. Like we're just talking here. Why are they holding back? Like, we could use, more supplies. We could use more resources. Oh, the other question, no. I know you're teasing. No. If you're sick here, we don't want you to go someplace else. That's just being a good American citizen. But I do really want you to get tested before you come home or at the airport, because I want you to know right away, if you're positive, and to isolate.
Governor, if I just may follow up on the second part of my question, which is, why is Twin River open tonight? You mentioned Black Friday in your earlier remarks. Are you expecting people to turn up at box stores and, large groups of people to be shopping the day after Thanksgiving? Why would today be any different than a week from now or 2 weeks from now in terms of the danger of these sorts of activities?
So it's not really. And if I had a magic wand and I could shut everything down immediately, I would do that. But as I said, I have to be somewhat practical. People need time to make their plans. A lot of restaurants have already purchased a ton of food for next week. I want to be fair and let them literally eat through their inventory. So it was a compromise. This is not perfect. I'm just trying to find that balance. There is also some logic in this following way. As Brian says, I haven't been able to get everybody to follow the rules when they're at home. So probably some people are going to engage in risky behavior on Thanksgiving. I really need people locked down for the weeks that follow Thanksgiving. So they're essentially in quarantine and not being mobile. Does that make sense?
It does.
So if you go hang out the way you're not supposed to do on Thanksgiving, you better not leave your house on Monday.
Governor, what does crisis standard of care mean regarding hospitals?
Your answer.
Similar to what the governor said, crisis standard of care is an approach we do not want to get to. It is a comprehensive plan that we have worked on with our hospitals that requires us to look at the resources that may be limited if the healthcare system is overwhelmed, and put into place principles that will help hospitals make decisions ethically on choices regarding caring for patients. It's a relatively complex process, but the essence that everyone should take away, crisis standards of care, is an approach we do not want to get to in Rhode Island because of the difficult decisions that healthcare would have to make in determining how to provide the best care for patients in scenarios when the healthcare system is overwhelmed.
So that could mean some patients would not get care. Is that correct?
In certain situations.
Can I answer that? In a less technical way? I'll tell you in a layman's terms what it means, because I'm very in touch with the numbers. It's going to be incredibly hard to staff all these beds. So as I said, we have 900 beds in the field hospitals. On one hand, that's great. On the other hand, we can't staff that many beds. So it means there's a staff shortage. So it means you might see a nursing student. You might see a medical student. You might not get checked on as often as you would in a regular scenario. But more specifically, like I said, the quickest way to make hospital beds available, quickest way, is to shut off procedures. So right now, the COVID beds in the hospitals are 97% of capacity. So the quickest way to free up beds is to say, no more cancer screenings, no more non-emergency services, no more non-emergency surgeries or diagnostics. So it absolutely means you won't get your care. It means you're supposed to go in for your heart surgery on such and such a date, and you're called and told, sorry, no room at the end, you got to put that off and reschedule it. And so that's what I'm trying to avoid by doing this. There are people who, I'll be very honest, there are people who would say, just let it fly with the economy, let the cases fly through the roof, and turn all your hospital beds into COVID hospital beds. Yeah, that's an option. That is actually an option. But that means when you need health care, you can't get into the hospital, and I think that that's an option that should be avoided at all costs, so that's why I'm doing this approach.
Governor, can I ask you about the nursing homes? I'm hearing from a number of listeners about short staffing at the nursing homes. This woman, her cousin, is confined to her bed. She hasn't had a bed bath in a few days. I've heard from a number of family members asking if they could volunteer to go in and bathe some of their family members at the nursing homes.
Yes. Okay, this is heartbreaking, and it's a reality that we're dealing with. There is something called, it's like a caregiver exemption, where if a family member goes through like limited classes, they could be classified as a caregiver and could go in on a limited basis, similar to what a CNA would do to take care of their family member. I am not announcing that today because we have a little bit more work to do to make that a reality, but it's top of our list. The doctor's team's working on it, and I hope to be able to do that really soon.
Okay. Do you have any thought as to why the outbreak is once again happening in the nursing homes?
It's really hard to prevent it. Everybody's so close to each other. You know, first of all, it's a very frail, vulnerable population. Second of all, you know, every resident of a nursing home is in contact with a lot of people every day. And also, a lot of the healthcare staff travel. Like, they might work in someone's home one day and then in the nursing home another day. So it's any congregate environment, like we had an outbreak at the ACI, we had an outbreak at the Slater Hospital, any like communal environment is tough. When you add on top of that the fact that people are older and sick, it's brutal. But we want to get to a place where that woman could go in and bathe her cousin. And
Okay.
so just hang on a little bit.
Okay. One quick question about, we're going to be one of the pilot states for the vaccine from Pfizer. But Rhode Island, I believe, also announced that we're also going to do our own test on it before it's approved. Is that correct?
Not so much our own test, but our validation of the data that is going to be released. So I've set up a vaccine advisory board, and they're going to be combing through all the data, just, you know, to make sure that they agree that it is safe.
Are you going to take the vaccine when it's available?
Yeah, absolutely. Now, let me say, I shouldn't be first in line because I'm not a healthcare worker, and despite what my children say, I'm not old, and I have no underlying health conditions. But when it's my turn in line, absolutely.
Last two, Anita and John Howard. Two brief questions. In regards to the pause, you're putting, you know, extreme restrictions on people's lives, yet you're keeping indoor dining open.
Yeah.
How do you square the two?
So again, nothing is perfect, but the indoor dining is going to be restricted. Bars are going to be closed. That's where we've had the most trouble, is bars. They're down to 33%, and we're still pushing the outdoor. And it could only be one household at a table. Other places, you know, like gyms, for instance, that when you're in a gym, you're mobile. You're mobile. You're also exerting. You're breathing heavily. You may or may not keep your mask on the whole time you work out. So there's no science to it. But it is, like I said, the method is group activities indoors where people can't keep their mask on the whole time. That's where we want to do our best to limit.
And 2 days ago, you told my colleague Kim that you were still in favor of remote learning. 2 days later, here we are, and you're changing Rhode Island high schools. What changed in those 2 days?
What I said is, she said to me, are you going to close all the schools? And I said, no, and we're not. K through 8 ought to be in person. We're giving an option to the high schools to use their limited in-person, you know, their virtual option, because we want, some of them have come to us and said they're having trouble containing their high schools. They need the high school space to do de-densifying. So I don't love it, and the ones that can stay open, I think it's great, but the superintendents have said, for a couple of weeks, give us a little breathing room. If you want to keep the K through 8 in school, we might need some breathing room at the high schools, and so we said fine.
John Howard.
Governor, what is your advice to the General Assembly that is looking to reconvene? And secondly, when it comes to the field hospitals, is the thought that you would fill up one hospital and then open the next? Or are you looking to sort of level it between hospitals as you're going along?
Yeah. So the General Assembly needs to get back at some point in time this year, when they choose, to pass a 21 budget. That is a necessity. And they've, you know, I've spoken to the new speaker, you know, the former speaker and Senate president had committed to doing that. The new speaker, I think, is going to honor that. We need a budget. You know, we need a 21 budget. And so they ought to... You know, again, that's up to them. If they can do it virtually, They can come in after the pause and do it for a day. I believe we're setting up a space for them in the convention center. No, we're not. Oh, excuse me, here or Rhode Island College. So I'll let them figure that out. They have to figure out how to do it safely. I think they're figuring out how to do it like in a day or two. But sometime between now and December 30th, they need to convene to pass a budget and put the bonds on the ballot. So the details of that, I'll let them figure out. The field hospitals, that is a call the hospitals will make. So Care New England and Lifespan, they're on top of that. They have plans, they have triggers, they're in the driver's seat managing that flow. They're the experts. So they're in communication with us. We're providing stimulus funds for them. This also is going to be another big slug of our stimulus funds now for the hospitals. But they have triggers. The Cranston will be available the week after Thanksgiving. Convention Center will be ready December 1st. And then it's up to them to manage their patient flow.
Last question, Brennan.
Michael.
Hi.
Scholastically announced earlier this week that they were going to tentatively start winter sports on December 11th. That falls under the 2-week pause period. Are you working with the league to get a new restart date? And is it realistic at this point to expect it to happen in January?
So we are working with the league. We have said that high school sports, the winter season, cannot start until January. We're going to work with the league to figure out what date in January that will be. And during the pause period, there can be nothing, including practices. So pause is no practices of any kind. And Janet Coit, I think, is in daily contact with the league to try to figure out when the winter sports season will begin. In Connecticut, they went to January 14th. We're looking at that as a potential date, but it'll be sometime in January.
Thank you.
Bye.